Coming up next is Dr. Kimberly Taylor. Here's your chance to talk about what matters to you. Although you will receive helpful advice from Dr. Taylor, remember, this is not to be construed as a form of psychotherapy, diagnosis, or treatment, and cannot replace a therapeutic relationship with a mental health professional. You can reach Dr. Taylor by calling 564-1290 or toll free at 866-564-1290. You can also listen live on the internet at drkimtaylorshow.com. So here now is Dr. Kimberly Taylor.
Welcome to the program today. I'm really glad that you could join me. I'm going to be spending the next hour talking about addictions and the treatment facilities available to treat this growing problem. I'm also going to have an expert in the field to help walk you through the steps that you should take if you or a loved one needs to enter into a treatment facility. Now, a common question is, when is it time to go into treatment, or can and should people try to do it on their own? Addiction is a more common problem than many of you may think, with 8% of all adults in the United States having had some form of substance use disorder or addiction in the past 12 months. People can be addicted to substances like alcohol, prescription drugs, street drugs, food, or in activities such as gambling, sex, shopping, even video games and the internet. The truth is, if you or someone you know is demonstrating a lack of ability to control your use or activity, or you find yourself constantly thinking and craving about these things, and that you continue to use them despite growing consequences in your life and in your relationships, then you may need to seriously consider a treatment option sooner rather than later. And just like any other investment that you make, you want to really be able to thoroughly research all of your options when it comes to a treatment facility. So what are the questions that you should be asking when choosing an addiction treatment program? Well, it would be things like, is the program licensed and accredited? What are the credentials of the therapists and staff involved? And what types of treatment are offered? So I really encourage you to call in today or even email me right now if you have a question. And if this is not a problem for you, I still encourage you to listen in and be a source for someone else in your life who is either struggling now or will be struggling with these issues at some point in their life. So you can reach me by calling 564-1290 or email me at drkim@drkimshow.com. So I am here with my guest, Kurt Garby, and he has spent the last 11 years as a marketing consultant to several treatment centers. And his focus has been really to assist families to find the right treatment program for their loved ones. So his insight comes from over 25 years of experience in the chemical dependency mental health field. So welcome to the program, Kurt.
Thank you, Dr. Kim.
Let's start out because what are the main reservations that people will have when they are thinking about going into a treatment center? What are they most afraid of?
Well, I think it obviously varies with different people, but I think so often people, they just don't know what to expect. There's been a lot of different movies and television shows about what treatment is and isn't, and I think so often it's not really an accurate depiction of what treatment really is. And so I think that the unknown so often will keep people stuck in the same behaviors just because of the fears of moving forward.
So that, I think, is why we're trying to do this program, to take the monster out of the closet and shed a little light on it and see what it is that actually happens within these treatment centers. Often, I think that people also are reluctant to ask for help because there's a stigma attached to being mentally ill or to have some kind of addiction. it's seen as a personal weakness or a character flaw. So how do you address this obstacle when you're talking to people?
Well, one of the things that I will reassure people about is, first of all, addiction really it's a disease, much like, let's say, diabetes or high blood pressure that needs to be treated medically. I think so often there's a lot of shame behind the illness for people, and they're just afraid to ask for help because they're just so embarrassed. I think if you can kind of begin to do some psychoeducation around the illness and that it is a disease, it's a kind of a biological brain illness, and because of that, you really need to receive professional treatment for that. I think if you explain that to people, they're a lot more likely to actually ask for some help.
Okay, and when do people actually come to ask you for help? You are someone who can talk about different treatment centers, and so at what point would they come to talk to you about whether it's for themselves or whether it's for a loved one about trying to enter?
Well, unfortunately, one of the things that seems to go hand in hand with the illness is denial, whether it is for the actual addict or whether it's for the addict's family. And so often, I'm getting a call about a year or two too late when, some really bad things have happened, whether that's an overdose, whether that's an arrest. A lot of times, people do not ask for help or the family does not intervene until things are really, really out of control. And like so many things, if you get on top of, the disease, or if you get on top of treatment early on before things get really bad, the prognosis is much better. If you get that kid when he's 16 years old and just smoking a little bit of pot, it's a whole lot easier to treat him than to treat that same child when he's 25 and he's strung out like a dog on heroin.
Well, and not just that, but you just mentioned that when they're young, when they're 16, when they're under 18, the parents still have control. So the parents can more or less make him go into treatment at that point in time, where after 18 years old, you definitely need the consent of someone before they can go into treatment, correct?
That's absolutely true. Prior to 18, mom and dad can sign a child into treatment because they are the legal guardian. One of the programs I do some work for is an adolescent treatment center. It's called Visions, and most of the children they treat are being brought in by mom and dad. When you turn 18, it's kind of that magical date. At that point, from that point on, you're an adult, and you literally have to be willing to go into treatment. Now, obviously, there's interventions and things that families can do that can get someone to treatment, but it becomes a lot more complicated when somebody turns 18.
Okay, and I think this is a very important point that I also have clients that come in to see me, and parents have waited and waited, and they've gone through maybe a lot of parenting programs or a therapy, but nothing has really worked to turn their child around. And so by the time they get to that, as you say, the crisis point, this kid is already on the verge of turning 18, and it's almost too late.
Yeah, it's amazing how, I have a clinical degree and all that, but I'm also a recovering addict, and my family was not so different than any other. And, both my parents were pretty highly educated. My sister was, off in college, and I was really floundering, and there were some very obvious signs that I was struggling. But my family, unfortunately, kind of looked the other way, and by the time they really realized what was going on, I was 20, and it was really... At that point, it was really difficult for them to really bring about any change. If they had stepped in when I was about 16 or 17, I think I probably would have accepted help if it had been offered to me.
Mm-hmm. Okay. What does the research show us in terms of effective treatment?
That's a really, really tough one. It's so hard to do accurate statistics around addiction and recovery. The one group we've done a wonderful job of monitoring are the professionals. That's the doctors and the nurses, pilots, and the pharmacists. There are certain treatment centers that really specialize in treating professionals who have a license that's essentially on the line, and that's why this person's going to treatment. what we found within that professional crowd, and they monitor them for at least 5 years, in that crowd, the recovery rate is about 85%. It's just wonderful. Now, granted, that's probably better than the general population because they have that professional license you can hold over their head. But what we know is with good monitoring after good treatment, treatment can be very, very successful.
Okay, and probably here we should speak about, is once enough? Can they go through this treatment and expect to be better, or are there times that people have to repeat it?
Well, everybody's different. I went through treatment and got it the first time. A lot of people, unfortunately, will relapse. Not that that's imminent, but the good thing is when you are in treatment, there's always some beneficial gains. So often the good treatment centers have a strong family component. So the family is changing and learning while the actual patient is in treatment. So even if the patient does relapse, the family is going to respond to it differently, which will really help the person who's relapsed get back into recovery. So unfortunately, yes, people do relapse. Some people will go to treatment, numerous times before they get it. Others will get it the first time. I think people who go to longer-term programs from the beginning have a better shot at remaining sober. Longer in treatment is always better, but a lot of people will go to those 30-day programs because it's the easier, softer way, or because they have to go back to work because they have a job.
Mm-hmm.
But longer is always better.
So how long does the average stay last?
Well, there's 30-day programs, 60, 90 days. It really depends. Most of the programs for adolescents and younger adults are anywhere from 90 days, sometimes even longer, with a sober living component after that. A lot of the programs for adults, because they have to go back to work, a lot of times they can only get 30 days off, and then they got to go back. So there's different programs. Now, we talked about people having to go back to treatment. There's specific programs for individuals who would be considered chronic relapsers, meaning people who've gone to treatment 2, 3, 4 times and just can't seem to get it. The chronic relapse programs are almost always longer, more like 6 months, 9 months, so the person can really get a good grounding and foundation, which will give them a chance to stay sober this time around.
So when people call you and ask about a treatment center and ask you what is the best one, because what you've told us so far is that a lot of these treatment centers specialize. It can either be by age or a profession or whether they're a chronic user and need more time. How do you determine which treatment center is best for them and whether they go into more of an outpatient or an inpatient facility?
Well, I'll always do a workup before I start making recommendations, find out how old the potential patient is, what prior treatment, has there been any type of outpatient, has there been any inpatient treatment. I'll do some family history to see if there's a history of, major psychiatric, do a little bit of history around to see if there's any trauma. I want to have a pretty good feel for what's going on before I make recommendations. Now, once I've done that, I usually will give families 3 different options, meaning 3 different treatment centers. Now, in gathering this information, I'm also going to find out if the family is totally dependent on insurance to pay for treatment. Is there, financial means outside of insurance to help? So there's quite a bit that goes into it before I start giving out options. But I want to try to match the patient up with a place that's going to have the clinical pieces in place to really have a chance to get them better.
Do you do most of this by phone, or do you go and meet them and the family?
I actually do almost all of it by phone. I actually, am doing work for some other programs, and so I travel extensively to treatment centers to figure out who's doing what, who's doing it well, etc. So I know where to direct people. But because of that and because of the travel, I do most of it by phone.
Okay. And is there something that people need to do to prepare to talk to you? Do they need to gather insurance info, or is there something else that they need to do prior to talking to you that would help that first phone call?
Well, they just need to be prepared. I need usually at least 30 minutes to ask all the questions I need to ask to kind of get a good feel for it. They need to be in a quiet place where they've got at least a half hour to spend with me, because I need to ask a whole lot of questions. And I want to get the person in the family who's the best historian, who's going to be really honest and explain to me what's been going on. All of what's talked about is confidential, so there's nothing that's going to get out there. But I need people to be really honest with me, because if I don't know what's going on, it's difficult for me to make any type of recommendation. So usually within a family, there's kind of that family spokesperson who's the best person to talk to, and it's, quite frankly, oftentimes that's mom.
Okay, and do you charge a fee for this?
I do not.
Okay, so if someone wanted to reach you, how would they reach you?
The easiest way to get a hold of me is actually to call me on my cell phone, which is going to be on the website, I'm assuming. I think you had said you would put it on there, or do you want me to give it now?
Sure.
My cell phone is the easiest way to get a hold of me, which is 805-302-2560. 805-302-2560.
Okay, and I will put that up on my website. We are going to take a short break, and we'll be right back. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll-free at 866-564-1290.
I am here with Kurt Garby, and he has spent the last 11 years as a marketing consultant to talk to people about how to find a treatment center should they need it for themselves or someone in their family. So, Kurt, one of the questions that I do have is that these treatment centers are very expensive. So, will insurance generally cover the full cost, and for how long?
It depends on the treatment center. Most insurance plans, the traditional plans that are not HMOs, are going to have an out-of-network benefit, which will allow you to go to some pretty good treatment centers, and typically it's going to cover at least 80% of the cost, sometimes even more than that. So usually you're going to have a pretty good shot at it. Now, most insurance plans will have both coverage for detox and residential care, as well as a step down to more of what would be considered a partial program or things of that nature. So oftentimes insurance will cover for 45 days, sometimes even a little longer than that, maybe even cover for some IOP or intense outpatient program after that.
So there are some, pretty high-end treatment centers. Can you give us a range of costs? Because there are some that are going to be more what I'd call a 4-star. It has a lot of, whether it's location, amenities, etc. So what is the range of a treatment center?
Yeah, it is definitely very, very dramatic. There's a number of programs in Malibu now, probably 20 plus. Most of them are going to run a minimum of $40,000 a month, and they can be anywhere up to $75,000 or $80,000 a month. Some of which will even do private rooms, which would be closer to maybe $90,000 for the month. Most of them are good programs, but unfortunately, there are some programs that are not. You're definitely not getting what you're paying for, and that's why doing some research is so important. Now, there's some really pretty sound dual diagnosis programs. Now, when I say dual diagnosis, I mean programs that don't just treat chemical dependency, but will be treating underlying depression, anxiety, bipolar illness, other psychiatric conditions. There's some really good ones that are maybe $20,000 to $25,000. Now, granted, you're not going to get nearly the amenities, and you're not going to be in Malibu, but that doesn't mean you can't get better.
Well, let's talk about that aspect, because do you need to be in a place that you look at the ocean and you have acupuncture and you have massage and whirlpool tubs in order to become sober and get the therapy that you need in order to move on?
Well, Yes and no. There are certain people that come, certain wealthy people that are kind of used to all of those things that will allow not having those at their disposal to be an excuse for not going to treatment. When that's the case, great. Get out your checkbook and write that big check and go to one of these programs. That's fine. But generally, your average Joe addict doesn't need all of those things to get better. I mean, it's some wonderful stuff, but you definitely don't need that to get better.
So what would be a general overview of what the treatment would look like on a day-to-day basis in, let's just say, maybe one of the average treatment centers?
Well, you'd have your breakfast in the morning. Following that, there'd be kind of maybe some, kind of meditation time. Most of the programs incorporate a nice physical component, early recovery. It's so important that you start to get in touch with your body again. A lot of them will do yoga or have some type of physical recreation in the morning to kind of get you going. Following that, you'll start with some different groups. Most of the good programs are going to have recovery groups that are kind of centered around the drugs and alcohol. They'll also have groups around trauma. Most people who enter treatment have had a lot of traumatic experiences. Part of what should happen in treatment is to start to kind of look at that and start to begin resolving some of those issues. They'll also have other groups in the afternoon focused on family, focused on relapse prevention, focused on sober fun. One of the very, very important things that needs to occur in treatment, especially with that younger crowd, is you need to figure out that you can have some fun sober. That's a huge deal. Most of the adolescents and the 20-somethings, they better figure out they can have some fun with this, or they're just not going to do it. Mm-hmm. Most of the programs, especially the ones that really cater and gear themselves towards that younger adult, have some components that are therapeutic, but they're fun, that these kids start to realize, oh my God, I'm having a good time here and I'm not loaded. Mm-hmm. That's really important. And then usually that'll take you up to around dinner time. At that point, if it's a 12-step program, usually following dinner, they'll take you out to a 12-step meeting. If it's a program that typically treats a younger crowd, they'll try to get you to a young people's meeting, which will provide a whole lot of sober, younger people around you so you can begin to figure out socially. You can have some fun with that. Then it's back to the house. They oftentimes will have some free time in the evening, and then they kind of have what would be considered a 10-step group where you kind of look at your day, what you did, what worked well, what didn't, what you want to focus on tomorrow, and then after that, it's usually lights out.
Okay, and what kind of freedom do they have? Can they come and go, or do they have to stay within the facility? Do they go out with a group?
Well, that's really changed, and there's different pieces to that now. Most programs in primary treatment, that first step, are going to be pretty restrictive. You're only going to be going out with staff or other patients, and there's 24-hour supervision. Some programs are a little bit more lenient around that. Some of the Malibu programs give you, and some of the kind of the higher-end luxury programs give you a little bit more freedom because they figure if they don't, you may not come. But still, you definitely need to be monitored. Usually, for at least for the first 30 days, there needs to be 24-hour supervision by staff.
Okay. Do they sign a contract? And what if they don't like what's going on? Can they leave?
They can. The only facilities that can keep you against your will are the psychiatric hospitals, and they can only do that if you are deemed a danger to self, others, or gravely disabled. Then they can theoretically hold you for 3 days against your will. None of the rehabs or drug and alcohol treatment centers can hold you against your will.
Okay. And is there an average of how many people at any point in time are within the treatment center as far as the clients there?
Really varies depending on treatment centers. There are some treatment centers that are rather large and will have 100 beds and will have 100 people in treatment. There's other places that are very boutique-y and very small that may only have 6 beds. In California, many of the treatment centers are, especially the ones in Malibu and down at some of the Orange County beaches, they're almost all 6-bed facilities. Now, they may have several houses, but in one address, you can only put 6 patients. So there's a lot of smaller places. So it really depends.
And what about, should they try to look for someplace that is close to home so that family can come and visit? And is this encouraged or discouraged?
Well, personally, the way I look at it, if you're an adult and you have a job and you have a family and kids, the best place for you to be treated, if possible, is in your own backyard, in a treatment center very close to you, so you can start going to 12-step meetings, start making friends, clean and sober, start getting used to changing your life around where you live, so the transition back home will not be such a shock. That's, again, if you're older and you have a job you got to go back to and a family you got to go back to. Mm-hmm. These younger adults, I think most of the younger adults, you need to get them out of town. Everybody they know is using, and there's just too many triggers for them, and it's too easy for them to walk out the front door and call a buddy to come get them so they can get loaded. The younger crowd, I like to send them out of town and get them a ways away. Because then it just kind of, they're much more likely to stay in treatment a while.
Okay, we need to take a break, and we will be back. If you would like to reach Kurt Garby, you can reach him by calling 805-302-2560. And, of course, if you have a question for us that you would like to have on air, you can reach us at 564-1290. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll-free at 866-564-1290.
I'm here with my guest, Kurt Garby, and he spent the last 11 years as a marketing consultant to several treatment centers. And he's also comes from over 25 years of experience in the chemical dependency mental health field. So we are trying to answer some of the questions about what is a treatment center, what does it look like, when should you call, and when should you go. And with that in mind, I have an email here which I want to read to you and see if you can answer, because we did bring this question up. It's from Tammy, and it says, Dr. Kim, my son is ruining his marriage by drinking, and I think his wife is at the end of her rope and asking for help. My husband and I have spoken to him numerous times, but he is unwilling to see it as a problem and just tells us to mind our own business. Is there anything that we can do to get him into treatment if he does not consent? What do the intervention therapists do, and how can they help? Please help us. They have 2 young children, and I worry about their future if this is not resolved. What would you say about having a person come in that could help with the intervention?
Oh, I would absolutely. The first thing they should do, there's a book called Love First that they should go out and buy. They can get it at Barnes & Noble. It's a Hazelton production. It's Jess and Deborah J., and it's called Love First, which begins to kind of explain the intervention process to kind of take away some of the fears for the family. Secondly, at that point, I'd be a good person to call. I know a number of professional interventionists. That's what they do for a living. They've been highly trained to step into a chaotic system and really assist the family to get a loved one to treatment. It's a remarkably powerful event. It's not a shaming or blaming type of deal. It's really, really incredibly effective. Good interventionists, when they do an intervention with the family, 85% of the time, somebody's going to treatment. And it's really a very, very powerful event. So people don't have to be willing to go to treatment to get there. The wonderful thing is Hazelton, which is a treatment center up north and out in Minnesota, and been around for, probably 60 years. They've done studies over the years, and they found that people who go into treatment following a family intervention are every bit as successful as people who walk in voluntarily. So it's a very powerful thing. The sad thing is people usually wait too long to do that intervention,
Mm-hmm. So if you have somebody who is at home and they are abusing or they are addicted to shopping or gambling, and they're sitting at home, At what point should they consider going into treatment? If on a scale of 1 to 10, with 10 being the highest, do you want them to start to think about this and to get help when they're at a 1, 2, or 4, or wait until they're 7 to 9?
Well, I'd say earlier is better. I mean, if at 2 or 3 you're realizing, whoa, wait a second, what's going on here? I don't like where my life's going. That might be a wonderful time to try maybe, let's say, an outpatient program. You're not that far down the line. It's not going to take as much theoretically to get you back. An outpatient at that point might be a wonderful treatment endeavor. If you're calling at 7 or 8, outpatient's not an option for you anymore. You need inpatient. The longer you're out there in your addictive behaviors, the more baggage, the more trauma, the more chaos that your addiction creates, and the harder it is for you to get better. If you get in the rooms early and you take care of your problem early, there's just less you got to work on. So earlier is always better.
And many people who are suffering from addiction, well, they also have a coexisting disorder like depression or anxiety, which has either been there and they're trying to mask it, and or they've kind of slipped into it because of the problems that they're having with the drugs. How do treatment centers deal with this, and are there different treatment centers to go to if this is an underlying issue?
Well, and this is something you really have to be very, very careful about. Pretty much any treatment center you look at now on the internet will say, we are a dual diagnosis facility. Now, having a psychiatrist come in once a week and meet with a patient for 10 minutes doesn't make a program a dual diagnosis program. Mm-hmm. The staff, you have to have licensed professional therapists, MFTs, PhDs, LCSWs. You need to have experienced therapists there. You also need to have a good addiction psychiatrist there. Now you can start making claims about possibly being a dual diagnosis treatment center, but so many programs will have CADACs or certified drug and alcohol counselors working as the case manager or therapist, and they're in no position to consider themselves capable of handling a dual diagnosis client. They haven't been trained to do it.
Mm-hmm. So if they call you, you are going to be able to help them to do this. But if someone is just doing their research online, some of the questions that they do need to ask is, what does a license and accredited system mean? And do the therapists and staff there have licenses in these areas?
Absolutely. You want to make sure your primary therapist, whoever's going to be doing the treatment with your loved one, is at least a master's level licensed therapist.
Mm-hmm. Okay. And not just the person as the managing director, but the actual therapist day in and day out who are going to be working with the people, correct? Correct.
Yeah, the actual therapist. Now, when you're looking at program directors, they should be, they have to be licensed. You want a PhD, LCSW, MFT, somebody with a ton of experience supervising others in a treatment setting. Mm-hmm. Doing treatment's tough. At treatment centers, it's stressful work. You need to have people in there that are really skilled and very, very experienced. Running a treatment center is not an easy thing. You want somebody who's had a lot of experience doing it.
And I think that oftentimes what you do find is those who have recovered also come back and become part of the staff or part of the support team. So it really helps that they are also there involved.
Absolutely. A good example, first time I went to therapy and I ran into a licensed therapist who was actually in recovery, I remember thinking, oh boy, the games are ending now, because when I'd gone to therapy earlier on, I could always manipulate the therapist because they weren't recovering, and so I would stay away from talking about my drug use and all of that stuff. It's wonderful to have some people on the treatment team who've been down that road. I think it's a huge advantage to have that.
Okay, because the main thing is that they know every lie, they know every denial, they know every way in which you can get out of it and not address the problem.
They're not gonna get fooled.
Okay, is there a certain treatment philosophy that people should be looking for when looking into a treatment center?
Well, the thing is, and there's been a lot of changes in the treatment world the last 10 years. It used to be almost all of the programs were 12-step based. And I personally, the 12-step saved my life. I love 12-step programs, but I understand there's more than one way to get better. Any treatment center, if it's not a 12-step program, there needs to be a very, very strong spiritual component. What happens is in your addiction, you begin to just become absolutely bankrupt in all areas of your life, especially spiritually, and it just ends up to be such a disease of addiction, and your addiction affects everyone around you and is ruining their life as well as yours. So you get to treatment just so bankrupt spiritually. There needs to be some type of spiritual shift away from self to others and service and this and that. If you can make that shift, you have a good chance of recovering. If you don't make that shift, you may stay sober a while, but the others in your life will be miserable because you will be. So there has to be some spiritual pieces to that. Now, when I say spiritual, I don't mean biblical or any of that. Spiritual, and that there's just got to be that shift. That's really what prolongs recovery and gives you a shot at having a good life.
What I have heard before is that some people who perhaps do not believe in a God, they have a problem thinking that it's going to be a lot about religion, and that the 12-step program is that it won't work for them unless they believe in a God. Can you speak to that a little bit?
Yeah, no, I hear that all the time. I went into treatment. I grew up in the church. I had a lot of baggage, so I went into treatment, thinking God had failed me, when in reality, nothing could be further from the truth. But I had a lot of dogma and baggage walking in there, so I thought, oh, this isn't going to work for me. There's talk about a higher power. Initially, my higher power was a tree in the backyard. And you know what? That worked until I got to that point that it was like, you know what? Wait a second. And I kind of reevaluated my relationship with God. And personally, that's, for me, that's what it is. But there are a lot of agnostics and atheists in AA, and there's literally meetings for agnostics and atheists. If they talk about a higher power, it doesn't have to be God. A huge part of AA is just getting you around other people with similar problems who can help support you, whose brain works just like yours does. And it's just such a wonderful source of support that will help you with your recovery. And again, there needs to be some type of spiritual shift, but it doesn't have to be about God. If you're struggling with that, the 12 steps can still work for you.
Okay, because you are trying to come to a place that you're coming from your highest self.
Exactly.
Okay. All right. We are going to take one more short break here. If you have a question that you would like to ask Kurt, please give us a call at 564-1290, and we'll be right back with Kurt Garby. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll free at 866-564-1290.
I'm here with Kurt Garby, and we are talking about treatment centers and how to find a treatment center should you or a loved one have an addiction that needs to be treated. So in all that we have been talking about, Kurt, is there one way, or are there certain approaches that have been tested and proved to have more success than others in order to achieve a full recovery?
Well, I think a program, what we know for a fact is you really need to treat the whole family. And I think when you not only treat the addict, but you address the family, you work the family around the illness, educating them how to support without enabling the addict. That type of program proves to be so successful because you change the whole system. Mm-hmm. What we also know is longer is always better. I know, especially with that younger population, you want to do a minimum of 90 days inpatient, followed up with another 90 days, maybe 6 months worth of sober living with an IOP, with a case manager. longer is better. If you can help that young person get a year under their belt, take that first cake for a year sober, they've got a really good shot. So many things have changed in their life. It's working for them. They figured out how to have some fun. They've rejoined the family. They're starting to get passionate about their life again. What happens is people get caught in this downward spiral of their addiction, and after a while they just lose themselves, and they don't know any better, and they don't know any different, so they just kind of keep coming from that sickness that is addiction. But if you can incorporate the family and do longer-term care, you got a really good chance at changing everything.
And then does the program also provide for an aftercare or a relapse prevention planning that is set in place prior to letting this person out of the treatment facility?
Absolutely. A good program will have what's called an aftercare plan with, let's say you're treated in, let's say you go up to Santa Barbara and you go to treatment at Cottage Hospital. Well, if you're going back down to Orange County, they will have found a therapist for you. They will have had a psychiatrist figured out if you're a dual diagnosis client. They'll also have a nighttime intensive outpatient program that you'll be going to. All of that stuff will be set up for you before you go home. That's not something that you need to figure out, because if you try to figure it out, you probably won't follow through and do it.
Mm-hmm.
So all of that should be set up, and those first appointments made, and all of that. And it's important at first, when you're in treatment, you're safe. You're vulnerable when you go back home. That's when you can get into trouble quickly and relapse. And so that first month or two at home is huge, and that's why it's so nice when you can do a sober living or some type of transitional bridge from treatment prior to going back home.
Well, when you're talking about some of these young kids going into treatment, and you're talking about a 60 or 90-day program or longer, for some, they can't leave work that long, or what happens to school for these young kids? Do part of these treatment centers incorporate schooling?
Well, all of the adolescent programs do. That's kind of mandatory. Year-round, they'll have a school on site. Visions, the place I had mentioned earlier, we have teachers who actually work for the Visions program, and they're there all year long. And so even if you're in treatment in August, you're going to school every day for 3 or 4 hours. So adolescents, absolutely. Now, so many young adults that go to treatment do not have jobs just because they're so far into their addiction, they keep losing them, and or if they have a job, it's part-time or it's as a barista at Starbucks. So it's not always something that they have to get back to. My belief is you can always find another job. You may not get another shot at recovery. So, you know what? Let's get it right. Let's make sure you're there long enough to really get it together. Now, Some of the young adult programs will have a college component, meaning after maybe 90 days of treatment, you'll step down to an intensive program at night and maybe start going to college during the day while they still have that safe container around you. Because that's a big, that's kind of a big trigger for some of these kids when they go back to school. And so there's a number of different young people's programs that have a college component woven in. There's also a number of major colleges now that have sober dorms to support sober young people when they go back to college.
Good.
But that's a big part of the deal. Obviously, for me, one of the huge benchmarks in my recovery, I got a whole bunch of highly educated people in my family, and I was the little opiate addict who couldn't go to junior college. So going back to college for me was a huge part of my recovery.
Okay, so what I hear from you is, number one, don't wait, that the sooner that you get the treatment, better off that it is going to be for all people involved. And what I also hear, and what I also know just with my own practice, is that being able to call someone like you who has experience, who knows a lot of these treatment centers, who travels around the country looking at them and checking them out, is probably the best next step that someone can take. So let's just mention once more your phone number that they can reach you is at 805-302-2560. Kurt Garvey, thank you very much for being with us. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. Nobody else has to change in order for you to get better.